tablets also you can find. There are special fluoride tablets. And 1 ppm, so milligram, 1 milligram per liter fluoride in the water provides basically that the low caries incidence. How is it going on? How will help for us the fluoride we are talking about today? So in normal climate, 1 ppm is necessary in the water. In cold climate, just 0.7 ppm is enough for to be caries protective, the water, and 1.2 ppm also in tropic climate, so hot climate, it's necessary for the caries protective effect. So the caries protective effect for the fluoride. Basically, which I would like to talk about in the seminar, the fluorosis, because there is a toxic effect, and the first manifestation of this toxic effect is the fluorosis, when we intake too much fluoride. Over 2 ppm, if we take in fluoride in the developing period of the teeth, it's not good because it's disturbing the amelogenesis and also the dentinogenesis. So in this case, the children will have white spots, yes, brown spots, so mottled teeth, which is not so aesthetic. It will be strong, so no caries, because when McKay in the USA, in Colorado Springs, basically discovered it, he find that everybody has brown and white spot on the teeth, no caries at that region, and that find that in the water it's high concentration of the fluoride. Because around the town was a lot of mine, and from the mineral, from the water is coming from there, from the mountains, and it contains a lot of fluoride. From the minerals it's coming there. And GB black acid in the mottling and the low caries incidence, high level fluoride in the water, which is useful. So suggest 1 ppm fluoride in the water supply. Basically, it's I won't tell everything, okay, because it was the lecture. Just the most important points I would like to summarize. So you have to know, you can find higher concentration fluoride in dried foods. The cooked food similar concentration have than before cooking, so it's not the same as the vitamin C, because in case of the vitamin C, the cooking is destroying one part of the vitamin C. And some ions can inhibit the absorption. For example, calcium, magnesium, and aluminium reduce the absorption. So when you would like to intake the fluoride and you would like to use it, it's better to intake without any kind of calcium content food stuff. For example, the dairy products. In the milk we have a lot of calcium, which inhibit, for example, the fluoride intaking. So avoid to eat calcium when you would like the fluoride to build in. Yes, some table absorption, oral mucosa, but mainly the small intestine, and inhalation, and through the skin it can happen. I would like to show that the plasma level is almost the same fluoride content, a little bit less fluoride content it has. So basically the saliva contains 70% of the plasma levels. But if you see, it's almost the same. If you eat some fluoride content food, it will increase and after will decrease in the blood. The saliva is the same, almost the same, but less concentration you can find. In childhood it's important, in the milk also the 50% of the plasma level you can find of the fluoride. Metabolism, just the most important points. So the concentration in the bone, outside and inside larger, between them around the same. If we see the tooth surfaces, in case of the enamel, the surface of the enamel has the largest fluoride concentration built in. In the middle of the enamel we have less, and at around the dentin enamel junction we have more. You can see here, this is the surface of the enamel. high concentration fluoride and after low concentration. At around the dentin enamel junction, again a little bit higher. And after it's the same, and at around the pulp it's almost will be higher, because in the pulp we have circulation, and with the circulation we can get some more fluoride. So basically at the borders we have higher concentration in the hard tissue. Okay, is it understandable? At the surface and in the dentin at the pulp we have higher concentration built-in fluoride. Between them basically it's the same and lower level. Also, if you see the root surface, on the root surface in the cementum we have high concentration fluoride on the surface, and inside less concentration. At the dentin cementum junction again higher concentration, and again at the pulp higher concentration. Creation. Basically, 3 level it's useful the fluoride. One of the most important effect for the morphology. If in childhood, at the developmental period of the leaves, we get in and we intake enough fluoride, it's modified the morphology a little bit. So with fluoride, the morphology will be a little bit better, because it's not really understood the mechanism, but it's working. Wider and shallower fissures, so not so deep and retentive fissure will developing. And basically, less susceptible dentin caries has some influence of development of the cells of the dental papilla. So it's a little bit different, the morphology and also the structure of the enamel, if we have enough fluoride in the developmental period. But the main reduction in carious lesion has been on the smooth surfaces. So in this case, if we have enough fluoride, the hydroxide group in case of the hydroxide apatite will change for fluoride, and it will be fluorapatite. And the fluorapatite is less soluble for acidic in the acidic environment. So more resistant against the acidic environment, the fluorapatite. That's why it's better if we use and more fluoride intake. This is the fluorapatite, and other kind of crystals are not so resistant against the acidic environment. So this is the solubility here, and this is the pH. And the fluorapatite is quite resistant, if you see. The brushite calcium fluoride and octacalcium phosphate, it's more soluble. And also it's very important that the plaque has a local effect in the mouth. It has an effect on the plaque bacteria. For example, significantly inhibition of the glycolysis inhibits the glucose transport, so they cannot fermentate so easily the glucose and other kind of carbohydrates. Cannot make acid, inhibits the acid production of the streptococcuses. And also inhibit the membrane ATPase, so the energy metabolism of the cells are not working so much. That's why this is the 3rd level as the fluoride is useful. So the first level, the morphology. With the fluoride, we'll develop a better morphological system, not so deep fissure, not so high cusp, so won't be so retentive. The other level is the hydroxylapatite fluorapatite, so the structure of the enamel, and the 3rd is the metabolism. It inhibits the metabolism of the bacteria. Toxic effect, the first sign is the fluorosis, but can be more serious problem, but not because of toothpaste and mouth rinses. In case of children, we have to take care about not to eat fluoride tablets. So not to give the fluoride tablets just which is necessary for a day, okay? Because it can cause problem. And lethal dose, it's important to know, okay? Sign this, because it will be also, can be questioned on exam, okay? It's 50 milligram per kilogram.
You said this is not a good value, the 15, or is the normal value?
The maximum.
It's the maximum. It's lethal. It's lethal. So if you eat this dose, you will die. So this is the lethal dose of the fluoride. Okay. Basically, it won't happen. because of toothpaste and fluoride tablets, but you have to know what is the lethal dose. It can be very serious problem. In this case, we have to give for the patient calcium gluconate, because you know the calcium inhibit the absorption of the fluoride. Okay, and we have to hospitalize this patient, and basically we have to give calcium salt, sodium bicarbonate, and maybe necessary to provide artificial respiration and cardiac stimulation if it's very serious the problem. That's it, and I will talk about, because this is the seminar topic, the fluorosis. It's a little bit more interesting maybe. I have a lot of pictures, so you can see different kind of seriousness of the. So Frederick Mackay developed it. I talk about it, okay, so I don't want to tell it again. So if it's high fluoride concentration in the local water, over 2 ppm per milligram, in this case will be low carries rate, but high mottling rate, so will be a lot of stain and discoloration of the tea surface. So he was Frederick Mackay, and Colorado Springs was it find that this problem at first was signed. Fluorosis, it's a pre-eruptive effect when the teeth developing in the enamel organ. Too much free fluoride ion concentration in the interstitial fluid can cause problem. Two forms of fluorosis can happen. There is the mild type, when just hypomineralized enamel and white spots you can see. Serious type, when this is the fluorotic type, and brown spots you can see on the enamel surfaces, and different kind of discoloration. The optimal when 8 between 10% of the hydroxyl ion substitution to fluoride. This is the optimal. If it's more, it's maybe can develop in not so aesthetic enamel. And this is the maximal, this provides the maximal acid solubility resistance. So too much fluoride is not good. Between 1 and 4 years old children can be the most dangerous, this problem, because in this period developing the permanent teeth in the bone. And in this case, if we give too much fluoride, it's disturbed the dentinogenesis, you know. Child is no longer at risk over 8 years old, because in this time all of our permanent teeth are developed. Maybe not erupted, because the wisdoms are just at 18 years old are coming, but until 4 years old we have to take care about how many fluoride give for the children. Because the main problem in the kindergarten many times is overdosing the fluoride tablets. And the result will be the fluorosis. You will see how it looks like. So what kind of fluoride tablets are possible? The Zimaflor contains 0.25 milligram natrium fluoride. The Dentocard contains 0.5 milligram also sodium fluoride. And Dentocard Forte, which is has a higher concentration, contains fluoride 2.21 milligram we can find in the Dentocard Forte. It can be dangerous. If the children take more than 8 tablets one day, it can cause fluorosis, okay? It's dangerous. So we have to take care about not to give it for the children. We have to dosing it. And not to use these fluoride tablets if the water concentration over 0.75 ppm. It's enough. If we have minimum 0.75 ppm fluoride in the local water, it's not necessary to give any kind of fluoride tablets, okay? Because it's enough. So this is the Zimaflor and this is the Dentocard tablet. We use it at that region where no fluoride in the water. And in this case, can developing a more resistant enamel. What we can find on the enamel in case of fluorosis? We can find spots, stains, white, yellow and brown spots, pitted, rough, hard to clean, and higher plaque retention happen because it's not smooth surface, not shiny surface of the enamel. stains and spots are permanent and may darken over time, so it's very unesthetic. This is the first sign when it's a little bit yellow, and basically it can be chalky white. It's very similar to the incipient caries, but the incipient caries is just on the predilectic places, so rather at the neck lesion. When the patient just horizontally brush the teeth, you can find this white spot lesion just at the cervical region, okay? Just the predilectic place you can find. The fluorotic spots are everywhere on the tooth surface. We have to make a differential diagnosis because there are very similar diseases. For example, the terminal hypoplasia, usually more localized, so we can find it just on the two teeth. Amelogenesis imperfecta, also it's very similar. You can see some sample for it. So this is the Turner type teeth. You can see basically defects on the central incisors, and just locally. So not every teeth you can see, just for example in the incisors in this case. Amelogenesis imperfecta, rather the structure is different of the teeth, if you see. Not spots and discolorations you can see, rather that you can see that the enamel surface is not smooth and the shape is not normal, it's abnormal. There are a lot of pit fissure and small projections on the surface, so it's not smooth surface you can find. And what about the water content? So if 0 ppm fluoride in the water, it's poor.
You mean the water in the house?
Basically, in Debrecen, it's between 0.4 0.7, so it's a little bit less than normally. But somewhere it's enough because 0.7 is okay. 0.4 between 0.7 is suboptimal, so it's not still not caries protective. Between 0.8 and 1.2 ppm it's caries protective, but over it, it's caries rich, it's fluoride rich, and it's not good. It's caries protective, but it will cause fluorosis. So that's why very important to check it. Everywhere in every town is checked the fluoride concentration. So if it's higher, there are some mechanisms which reduce it, okay? But if there is no fluoride in the water, it can be necessary to intake some fluoride with tablets, with the help of tablets. So you can see how severe can be. So this is the normal case. It's questionable because somewhere we can find white spots, very mild. When just the incisional edge, you can see some chalky white spot. It's mild, and it's moderate and severe, you can see, but there are more severe cases. Also, you can see the difference between of the stages. And as you see, it's not localized. Everywhere you can find these lesions if the patient has fluorosis. Not just one tooth, everywhere. So in the canines, the central and the lateral incisors, and also the lower incisors, everywhere you can find minimum a little spot, white spot. And it's diffuse, if you see. And sometimes not just spots you can see, there are some pit and fissure and rough surface also, which is not good because it's more plaque retentive. And these are the more serious fluorotic cases. It's very, yes, it's very anesthetic. Basically, it's more resistant against the acidic environment, so not possible to make and developing caries. Less chance this patient to have caries, but it's anesthetic. And it's not good because the patient can clean it more difficult. So it's more plaque retentive, and also the discoloration later can happen easier. What can we do in this case? Treatment possibility. We can use microabrasion, and we can use bleaching sometimes, and we can use composite restoration, and in the most serious cases, we can make porcelain veneers. So we have to prepare that surface, and we have to cover it with porcelain veneers. So like here, before and after, you can see. also porcelain wieners. So we have to prepare the surface, so the vestibular surface of the teeth in case of the incisors, and after we fix it and cement it with the help of different kind of cement. Can be dual cement, glass enamel cement.
We don't use a
Wiener. Or what is the question again?
the disc that we use for the
It's a special disc just to make smooth surface for the preparation. Yes. Finally, we use different kind of disc and different kind of stones, Arkansas stones we can use. When you finish the preparation, at first you use the diamond burrs, but when you would like a little bit make finer and smoother surface, you can use different kind of green stone and the white stone you can use. Use it, okay, because finally it's better the surface, better the contours, and also you can make a better level of the chamfer. So it's useful, if not just the diamond instrument you use finally, okay? You can use the stones, the white stone and green stone, or also it's possible. So this is the preparation in a very serious case. Vestibularly we remove a little bit the enamel, and after we use a wiener and we cement on the surface. So it was the fluorosis. Any kind of question about it? Which is important